I'm Seyed Shobeiri. I'm a urogynecologist and I am the vice chair of gynecological subspecialties at Inova Women's Hospital. The childbirth is generally very safe for women, but as women deliver babies, somewhere about 40% of them do have some damage to the muscles in their pelvic floor that heals spontaneously. From those patients, maybe about 10%, however, go on to not being able to heal their pelvic floor muscles, and then they would have consequences in terms of urinary incontinence, prolapse, and other pelvic floor disorders. So the childbirth alone is not the issue. The pregnancy itself also affects the pelvic floor. So the cesarean section is not totally protective in terms of preventing pelvic floor disorders. But when we talk about vaginal birth alone, the one that women want to avoid is a forceps-assisted vaginal delivery. And this is the situation where the physician may decide to use a forceps to assist the baby to come out. And sometimes this is very important because the baby may be in danger. But the forceps are associated with about 7-fold increase in pelvic floor disorders. So for most part, with the vaginal birth, everything goes well and the mother is happy, the baby is happy, and the body will heal. So it's very rare circumstance when things don't go right, but at that point, really neither the patient nor the physician would know where to send the patient to. So we are one of the few centers around the country where we have perineal clinic, which means that if you have a 3rd-degree laceration, 4th-degree laceration, if you cannot void after childbirth, or if forceps was used during your delivery, we see you, and during our evaluations, we would evaluate your pelvic floor muscles, make sure the muscles haven't been torn. If they have formed hematoma, we may bring you back for a repeat ultrasound 6 months later to make sure they are healing appropriately. And then we would give you the attention you need in terms of referral to physical therapy, pelvic floor therapy, telling the pelvic floor therapist exactly what to do based on our findings. And if the patient has pelvic floor injury during childbirth, that's the patient that we actually have to follow long term in terms of evaluating them and make sure that we can give them guidance on what their next pregnancy and childbirth should look like. Sometimes we see patients and we say, based on our evaluations, you should not be having another vaginal birth. Or sometimes we see them and say, based on our evaluation, it is safe for you to have another vaginal birth. And if they do have irreversible damage to their muscles, then these are patients we would follow long term for years just to be there for them. So when they develop urinary incontinence, prolapse, or other issues, they would come to us because we're board certified in urogynecology and we can treat their problems. I'm Seyed Shobeiri. If you had a vaginal birth that you think did not go as you expected, please make an appointment to see us at our perineal clinic.